In determining if you're a candidate for LASIK or PRK, we have to measure a number of things. Number one, we have to see what is your prescription number. If somebody has a very high prescription number, they may sometimes not be a good candidate for LASIK or PRK. The reason for that is when we laser the cornea to change the shape of the cornea to adjust for your prescription number, there's a limit to how much of that corneal tissue is safe to laser. So if someone has an extremely high prescription number, it may require too much laser onto the cornea that's not healthy for the cornea long term, and they may not be a candidate for LASIK or PRK. Sometimes they become a candidate for something else, which is where we put an implantable lens in the eye to correct their prescription number. But going back to LASIK and PRK, when we do the evaluation, we take scans with a Pentacam. It looks at the steepness of your cornea. It's like a topographic map. It helps us understand the steepness of your cornea, make sure if you have any corneal astigmatism that it's regular astigmatism, there's no irregularities to the shape of your cornea, and make sure there's no pathology or diseases of your cornea. Once a patient is evaluated and we find that they have a healthy cornea and their prescription number is within range, we also have to look at the thickness of their cornea, because again, there's a limit to how much thinning of the cornea we want to do at the time of refractive surgery. So once we evaluate the cornea, do all the images and measurements in the clinic, then we'll also do a screening to see if you have any other health or medical problems, any other issues such as eye surface problems or things that may alter our plan for refractive surgery. Once we get a good understanding of the patient, the health of their eye, the measurements of their eye, the shape of their cornea, then we can determine what the best option is for you, whether it's LASIK or PRK or other options for refractive surgery. Then you have the actual day where you come in for the procedure. Ahead of your day for refractive surgery, you'll come in to have a refraction or measurement of your prescription number done. So you'll come in for a pre-op visit, we'll refract the eye, meaning get the measurement of your prescription number. We also take scans and images of your cornea. All that information from the cameras that take pictures of your cornea is uploaded onto our laser system so it can fine-tune or customize your treatment when you have your LASIK or PRK. We like to get that measurement a couple times just to make sure we're as accurate as possible. After the imaging is all done, after the measurements are confirmed in the office, we then plan the procedure day.